This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub Podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Elara, Research Fellow. Today we're looking at a fascinating new study from the journal World Neurosurgery, published in 2026. The title of the paper is Hemilaminectomy as an Approach for Intradural Extramedullary Tumor Removal.
This is a topic that sits right at the intersection of traditional technique and the modern push toward minimally invasive surgery. For our residents and students listening, intradural extramedullary, or IDEM tumors, like schwannomas and meningiomas, have traditionally been managed via a standard total laminectomy. But this study looks at shifting that paradigm toward a hemilaminectomy.
Exactly, Dr. Aris. The primary objective of this study was to evaluate the safety and effectiveness of hemilaminectomy, specifically as a minimally invasive approach for the resection of these IDEM spinal tumors. It isn't just about whether we can do it through a smaller window, but how it impacts the patient in the long run.
Right. The minimally invasive label is often used, but it's the data that matters. The paper places a heavy emphasis on two main pillars: functional outcomes and complication rates. When you're evaluating a surgical approach, those are the metrics that define success for the patient.
Let's dive into that effectiveness piece. When we talk about effectiveness in the context of IDEM tumors, we are primarily talking about the extent of resection. The concern many surgeons have with a unilateral hemilaminectomy is whether it provides enough of a surgical corridor to achieve a gross total resection without excessive cord manipulation.
That's always the trade-off, isn't it? With a total laminectomy, you have a wide-open view of the dorsal surface of the cord. With a hemilaminectomy, you're working through a tighter space. However, this study suggests that as a minimally invasive approach, it is effective for these specific tumor types. By preserving the midline structures, the spinous process, and the interspinous ligaments, you're maintaining more of the natural anatomy.
And that leads directly into the functional outcomes. Because the approach is less disruptive to the posterior tension band and the contralateral musculature, the study looks at how that translates to the patient's recovery. In neurosurgery, a functional outcome isn't just a neurological exam, it's the patient's ability to return to their baseline.
And for the residents listening, remember that safety in this paper is evaluated through the lens of complication rates. When we discuss IDEM tumors, the complications we worry about most are CSF leaks, wound dehiscence, and postoperative spinal instability. By using a hemilaminectomy, you are theoretically reducing the dead space where a pseudomeningocele could form.
The study specifically focused on those complication rates to see if the limited exposure increased the risk of accidental durotomies or if it actually protected the patient by limiting the surgical footprint. It's a delicate balance, ensuring enough room to safely dissect the tumor away from the nerve roots or the cord while staying as minimally invasive as possible.
I think it's important to highlight the paper's focus on the approach itself. It frames hemilaminectomy not just as a smaller hole, but as a deliberate strategy. If the safety and effectiveness are comparable to a full laminectomy, then the functional outcomes, like reduced post-op pain or shorter hospital stays, become the deciding factor for moving toward this as a standard of care.
It's also worth noting the specificity of the tumor location. The abstract mentions IDEM tumors generally, but in practice, the success of a hemilaminectomy often depends on the tumor's position relative to the cord. However, the study's conclusion remains focused on the overall safety and effectiveness of the unilateral approach for this class of tumors.
For our practicing neurosurgeons, this 2026 data really reinforces the trend we've seen over the last decade. We are moving away from the exposure at all costs mentality and moving toward precision exposure. If we can achieve the same resection through a hemilaminectomy without compromising safety, we're doing our patients a service.
Definitely. To recap for our listeners, this study in World Neurosurgery provides an evaluation of hemilaminectomy as a safe, effective, and minimally invasive approach for IDEM tumors, with a clear focus on optimizing functional outcomes and minimizing complication rates.
It's a great reminder that sometimes less is more, provided the safety profile holds up under scrutiny. Thank you for walking us through that, Dr. Elara.
My pleasure.
That's all for today's episode of the Neurosurgery Hub Podcast. Stay sharp, and we'll see you in the next one.